Excellence in Epilepsy Care at Children's Hospital. My name is Vicki Hayter, and I'm the Director of Legacy Giving at Children's Health Foundation, and I'll be your host for this evening. I'd like to kick things off now with our board chair, Alana Johnson. Welcome, Alana.
Thank you, Vicki. I would like to welcome everyone who's joined us tonight and begin by giving a very solemn land acknowledgement. I would like to acknowledge the Anishinaabe, the Haudenosaunee, the Leapawok, and the Attawaddarun peoples whose traditional lands we are gathered upon today. Every year, CHF fundraises for research priorities, including epilepsy. Tonight, we share the excitement around the innovative research being done in epilepsy right here in London. The purpose of our evening this evening is to learn about the programs being developed to improve life outcomes of children living with epilepsy. You will also gain a better understanding of the long-term impact of epilepsy on the quality of life and uncover some of the vital, groundbreaking research being conducted here. We have together raised funds for Children's Hospital and Children's Health Research Institute. The research happens at the CHRI, and then it goes from bench to bedside as our world-class physicians provide care to patients within Children's Hospital. I would like to mention that we are recording this session tonight for those who were interested but unable to attend. And you will be able, as the audience, to post questions in the question and answer throughout, and we will take these up at intervals throughout the presentation. Now it is my great pleasure to introduce Dr. Craig Campbell to kick things off. And Dr. Craig Campbell is the interim co-chair chief at Children's Hospital, and he is a great example of a world-class clinician and researcher. And he is the Researcher Scientist and CHRI Scientist of the Year in 2019. Welcome, Craig.
Thanks so much, Alana. Really warm welcome to everyone who's joined us tonight. I'm just gonna try to get those slides to advance there. Can everyone hear me okay? Okay, well, my slides are not moving forward here for me, but let me just start by saying a warm welcome to everyone who's joined us. I really am very excited about tonight. We're going to share with you through two of our epilepsy team members, Dr. Andrea Andrade and Dr. Kathy Speechley, some of the innovations that are happening in epilepsy care at Children's Hospital and the Department of Pediatrics. We're also have a special family joining us who have been through the journey of epilepsy, and we're really excited that they can, share some of their experiences. Oh, great. Let's see if I can get those. Maybe this will get us started. And of course, a huge thank you to all of you for joining us. Probably some of you who have been donors to the Children's Health Foundation, maybe some of you are thinking about donation, but what we want to share with you tonight is some of the innovations that donors and Children's Health Foundation support really enable. And we're going to do that reflected through the journey of a family, a patient named Travis Hagee, as well as some focus on both epilepsy surgery innovations as well as epilepsy research. But I do want to share just some broad stroke overview with you first. Epilepsy affects about 1 in 100 people. across the whole lifespan. But the peak onset of epilepsy is in childhood. And in fact, as pediatric neurologists, and I lead the division of pediatric neurologists, we see a lot of things. We deal with headache, we deal with kids who have muscle weakness or changes in their, in their development. But whether we're in the emergency department, in the neonatal intensive care unit, the pediatric intensive care unit, or in our offices seeing patients in clinic, by far and away the most common issue that we're partnering with families on and grappling with is the problem of seizures and epilepsy. And of course, epilepsy is not just one thing, just in the same way that it's a different journey for every family. We also are aware that epilepsy is caused by a myriad of underlying conditions, and in fact overlaps with many other medical disorders and diseases. And so not only do the epilepsy team have to be experts in understanding seizures, but they also have to become expert and think about carefully these many other related conditions or associated conditions. And so I want to impress on people that being an expert in epilepsy really requires considerable expertise. And because epilepsy is caused by very many different underlying causes, that expertise has to span right from the diagnostic side of epilepsy, so understanding the genetics and the causes, through to the seizure management, right through to helping families in a holistic way to deal with all the various things that come forward on that journey in trying to deal with epilepsy. Over the years, perhaps the biggest impact that I've seen in the family journey is the unpredictability of epilepsy. Seizures are often by their nature unpredictable, and just when a family seems to take a deep breath and say, "Oh, I think we're okay. We haven't had a seizure in a week or a month or maybe even a year," sometimes the seizures crop up again. And I will say this unpredictability of things and this ebb and flow of seizures is one of the greatest challenges for families, and certainly for us as physicians to try and manage. And of course, seizures are scary. There's a lot of social taboo about seizures, something that our team is trying to break down, and through education and information, we're able to take away some of that fear, or at least allow families the knowledge to approach their fears on this often difficult journey. And all these things make it very, very challenging for children and families who are dealing with epilepsy. And so that's, certainly why I'm proud of the team that we put together to support families. And I want to go through each of these groups on the team, starting with our physician team. Dr. Andrea Andrade, who's the lead for our epilepsy team, and she's going to talk to you tonight. Dr. Sandrine Deribo-Pierre is a neurosurgeon who's involved in the epilepsy surgical side. Dr. Miriam Nori, who leads a number of our research projects and does significant clinical care in the epilepsy program. Dr. Narayan Prasad, who runs the ketogenic diet program. Tuche Balchi, who's a genetics specialist and has become a specialist in epilepsy genetics. And Mike Yerkowitz, who's a neuroradiologist and again a scientist and researcher in the imaging, MRI imaging, and other modalities of imaging in epilepsy. We're fortunate to have some collaborations with PhD scientists on our team, one of whom, Kathy Speechley, you'll hear from tonight, but also Karen Bax and Natalie Berube have been instrumental in the investigation of different aspects of epilepsy. And finally, of course, with great gratitude, I introduced the health practitioner team. And these are a group of people who are not only experts in what they do, but they're experts in caring. And people like Michelle Grattan, who's soon to graduate into her nurse practitioner role, Carrie Charters, a social worker, Marty Kelly, an EEG technologist, Sabrina Friend, our neuropsychologist, and Janice Gray, the psychometrist, who do a lot of our testing. Bonnie Wooten, who has a unique role as a decision coach, which I think Andrea is going to mention later on, because there's many difficult decisions that families with epilepsy have to tackle, have to grapple with, and Bonnie's there to assist them. Sarah Denemy, who's a dietitian on our team, Tasha Hamilton, who helps to transition children and families from the pediatric epilepsy program to the adult epilepsy program, and Chantel Douglas. So immensely proud of this group to work alongside them. And just so you know, it's not only me that's immensely proud of them. I want to share with you a few quotes from people who I approached to give me thoughts about the epilepsy team. And the first is Dr. Carter Snead, who's at Sick Kids Hospital in Toronto and was a former head of neurology there and the head of the epilepsy program. And he says this: in 5 short years, the accomplishments of the pediatric epilepsy team in London have been legion and have brought Children's Hospital LHSC to the academic limelight, both in Canada and internationally, in terms of pediatric epilepsy care, education, and research. Our scientific director at the Children's Health Research Institute, Dr. Victor Hahn. The pediatric epilepsy team has achieved clinical and research impact in the provision of high quality, evidence-based care at the Children's Hospital and is conducting high quality and impactful translational research on epilepsy at Schulich and Western. And finally, from one of our community partners, the CEO of Epilepsy Southwestern Ontario, Michelle Franklin, she says, we are reminded how remarkable this team is, as our families often speak publicly and through social media about the exceptional medical care they have received and the compassionate approach of the pediatric epilepsy team. This is an accomplishment in and of itself, as many families fear the hospital setting and dread medical appointments. So I've just captured those 3 quotes from 3 very different people who see the epilepsy team through their lens, but share the same sentiment about how remarkable this group of people is. But again, I need to always come back to the center of our care. What drives our innovation, what drives our research, what drives our hard work every day to put the children and families at the center of what we do. And so with that, I think it's fitting, and I'm thrilled they're with us and willing to share their story. I'd like to introduce Travis Heggie and his mom and dad, Tim and Melissa.
Thanks, Dr. Campbell. I'm Tim Heggie, and I'm here with my wife, Melissa Heggie, and our 17-year-old fantastic son, Travis. And we're here to tell our story. It was when Travis was 8 years old that we first noticed he was having moments where he was blacking out. Travis would go quiet and stare off for 30 seconds to a minute, and he would not respond when we spoke to him, and he sat very still. This was happening about 1 to 2 times a week. During this time, we began to notice that Travis's response time and communication was slower. At this point, we contacted his pediatrician, and a referral was made to the Pediatric Neurology Unit at Children's Hospital. When we first met with Dr. Prasad at Children's Hospital, Travis underwent a series of tests, including an EEG, an SEEG, and various MRIs, and his seizures were identified. Travis was prescribed medication to control his seizures. Unfortunately, Travis's seizures progressed to the point where his body would go rigid and his right arm would twist inwards, even with multiple types of medication used. Through all of this, Travis was able to lead a fairly normal life while fully supervised and with a safety plan in place at school. Travis did continue to participate in various sports, including hockey and softball. When Travis reached puberty, his seizures became more complex and obvious to those around him. Without the assistance of various anti-seizure medications, Travis was having 2 to 3 complex partial seizures a week. He would stiffen on his right side, curl his arm, mutter for about 30 seconds, and really black out to what the reality was with everything else out there. Around this time, Travis began to see Dr. Andrade at the neurology unit. Travis continued with his new and increased medications, but his seizures did persist. The frequencies of his seizures at this point were 3 to 4 per week. However, we were able to often carry on without much suspicion or public involvement. When they occurred at school, safety protocols were followed and sometimes did cause a lot of commotion within the class and the playground. When Travis was around 11 or 12 years old, Dr. Andrade began to speaking to us about Travis being a candidate for surgery to reduce or eliminate his seizures. Travis began testing to see if he would be a good candidate for the surgery, including more EEG scans and a multi-day and overnight EEG in the hospital, as well as a PET scan and cognitive psychological testing. Travis was selected as a candidate for the SEEG and temporal lobe lobectomy in 2018. We were nervous and scared, but we knew the benefits of the surgery for Travis could be life-changing for him. We were excited about the opportunity to give Travis some normalcy. Travis had the SEEG surgery on March 7th, 2019. This allowed the neurology team to gain an accurate picture of what the seizures were happening inside his brain. Although Travis was hospitalized for the entire duration of this several-week procedure, Travis was able to walk around the hospital and even leave to go for dinner and drives. After 10 days of monitoring and preparation, Travis then had his left temporal lobe and hippocampus removed on March 18th, 2019 to reduce seizure activity. This was a 4 to 5 hour procedure and was completed as expected by Dr. Deberbeau-Pierre and her great surgical team. Our time at the hospital was scary and stressful, but we were supported by the amazing staff there. We saw Dr. Andrade almost every day and sometimes multiple times each day, and we were kept fully informed about how things were progressing. Dr. Andrade's engagement in Travis's care, her personal responsiveness, and her overall confidence and compassion were absolutely second to none. Since Travis has had the seizure, he has luckily not had any other seizures. Travis has moved up an academic level in school and is doing quite well. He plans to go to college in a year or two and has earned his G1 license and is learning how to drive right now. Because of this surgery, Travis is able to lead a full and normal life free of seizures. He continues to be a great kid and very responsible and a happy human being. We are proud and honored to be his parents. We very much appreciate the opportunity to share our story here with you today and definitely appreciate the folks at Children's Hospital. Thank you.
What a great story, Heggie family. What a journey. I thought it would be kind of cool at this point, of course, to maybe take any questions, and we do have one. Travis, how did you and your family come to the decision about even having this surgery? And what did you understand would actually take place?
I'm not too quite sure, actually.
Do you remember when we decided that we're going to have the surgery to try to stop your seizures? No. He's still a typical teenage boy who doesn't really care a whole lot about stuff. So go ahead now.
So Dr. Andrade really explained the procedure to us, and we were very open and honest with Travis about everything that would be happening. And he knew that this would be life-changing, and this was an opportunity for him to be free of seizures. So we kind of made the decision together, and he was always open to it.
Great. Do we have any more questions for the Heggie family before we move on? I think one that I wouldn't mind addressing, just because I have actually, Travis, a 26-year-old with epilepsy. He was diagnosed at the age of 18. And one of the things I've been curious about, and any one of you can answer, is would you agree that the top 3 things that someone with epilepsy should take into consideration is sleep, nutrition, and low on the stress side? Has that been your experience for those 3 things?
Definitely those 3 things have impacted Travis and his seizures, the amount of seizures he's had, and how intrusive these seizures were for him. Definitely the more sleep he gets, the better he eats, and less stress has always been better for him.
Great, that makes sense. Thank you for sharing that. If we don't have any other questions, at least right now, we again would like to offer any of you to put them in the chat for the Heggie family. And again, as we go along or near the end, we can address those questions. But in the meantime, thank you so very much for sharing your story, you 3.
Thank you.
Okay, stay tuned here. We're going to keep on going here. I'd like to now invite Dr. Andrea Andrade to the screen, who is a neurologist and epileptologist, the director of our Pediatric Epilepsy Program and Pediatric Epilepsy Fellowship Training. Welcome, Dr. Andrade.
Thank you, Vicky, and thank you for the foundation for this wonderful event. And most of anything, thank you for the Travis family for allowing us to share the story and to share their experience with us. I don't have any disclosures for this talk, and I actually going to share the Travis story with their permission from my perspective as the physician who actually walked with them through this journey. So as you know, when I first met Travis, he was a young, in early teens. And as you know, he started having seizures when he was 9. Previously, he was managed with medications by my colleague, Dr. Narayan Prasad. And he was a very significant number of seizures. Travis also, because of the whole epilepsy, and as Dr. Campbell mentioned, not only had the epilepsy, but also other comorbidities that also affect him in his daily life activities that were related to his epilepsy, such as ADHD, autism spectrum disorder, and intellectual disabilities that were affecting him. He was taking at that point 3 different types of medications to control his seizures. And unfortunately, seizures and medication side effects were interfering, as Melissa and Tim mentioned, significant to the whole family quality of life and his school performance. Unfortunately, because of course, even in our best case scenario, we have limited resources. We have to wait a little bit to get the spot for Travis into the surgery and to build the case for him to go into epilepsy surgery. And I'm with the permission of Tim and Melissa and Travis, I'm going to just show you how his seizures look like, so you guys can get a little bit of a sense what was his experience every day. You will see they are subtle. He's happily chatting with mom. He's in our epilepsy monitoring unit, and you will see how at some point he gets this moment when he gets in a disconnection. He changes even his facial expression. He becomes very serious and quiet, and he dropped his head down, and then he was in this staring spell, and this was happening pretty frequently, and definitely Tim and Melissa were very good at picking this up and define these issues for him. As I mentioned, the surgery was performed in 2019, and we did that via robotics. with the support and collaboration with our colleagues from the university hospital, we were allowed to identify an area that is this white spot here in the left side of his brain, in the tip of what we call temporal lobe, an area that is also in charge of memory and other things that are important, especially in language and things like that. And we were able to, with the help of the robot, to identify the area where his seizures were coming from, and also to help us to make sure that there was nothing else important around that area, and we were able to tell Dr. De Riopiet to remove that safely. As you can see, we performed several different pictures of his brain that help us to put the case together. The outcome, as the Heggie family mentioned, was excellent. So you can see the area that we consider being the area causing the seizures. However, thanks to the robot, we realized that was not only the spot, but it was a little bit more extensive than that. So it was the anterior temporal lobectomy was performed, and now he's off medications, he's excelling at school, and he's getting his driver's license. And as you guys know, he's living a very happy life as a teenager, as he should be. And I'm going to go quickly on this because Craig touched base on these figures, but I just want to stress the importance of how many people in our province have epilepsy. And as we know, epilepsy typically starts in childhood, and around those 15,000 children that were considered to have epilepsy, around 30% of those may require other treatment options beyond medications. So it's very important to keep that in mind. Epilepsy is a condition that causes seizures in the brain, and that's how we understand it as a concept. And when a seizure happens, there's a disruption of communication between the brain cells that are called neurons, and disruption of how they talk to each other based on electrical activity. Epilepsy can be diagnosed when a person has at least 2 seizures that are not caused by anything that may be a reversal condition. And as we mentioned before, 1 in every 100 Canadians have epilepsy. In some figures that we have here, some children outgrow their seizures, and 70% will achieve good seizure control with 1 medication. Unfortunately, there's some of them that, in spite of medications, may require other treatment options, and medications are not enough. And as you can see, good thing is majority of our patients here respond to the first drug, but there's some of them that may require a little bit more than just medications. And the other very important thing that I want to stress is that seizures are just the tip of the iceberg, and there's another multiple dimensions that we deal when we are talking about epilepsy, especially in pediatric, especially in children. And one of the major things that I want to stress is that, as difference with adults, we are dealing with brain development. We are dealing when the brain is acquiring, is growing with the child, and is acquiring these amazing skills that make us who we are as humans. So that's why I'm passionate about this topic, because when we intervene in time, and if we intervene early, we can really make a difference in the lives of these children and families in general. Remember, seizures are just the tip of the iceberg. We're dealing with multiple different what we call comorbidities or conditions that may be also affecting a person or a young person living with epilepsy, including sleep issues, mental health problems, stigma that unfortunately is still there, mortality, family dynamics, cognition. So the quality of life is really affected by the epilepsy. And again, it's more than that. So if we can make a difference, we can do it. And if we can make a difference early on in life, I think that's probably, in my opinion, the best way to go. I'm going to focus a little bit more in this 30% group that they may not respond to medications, and why and when do we decide that epilepsy surgery would be an option for our children in the hospital. And I'm not going to bore you with the scientific papers and things like that for too long, but I just want to highlight here that there's numerous papers and numerous evidence and information and good research done that has proven that in those patients that may be refractory to medications, epilepsy surgery can be basically a curative opportunity for them. And here our colleagues from India compared two populations of children who don't respond to medication. And among these two groups, one eventually underwent epilepsy surgery, the other one stay on medications. And as you can see, seizure freedom in the surgical groups was 77% versus 4% in the non-surgical group. So staying on medications, the odds of achieving a seizure control and all the other comorbidities are very low. That's why we do epilepsy surgery. But of course, it's not just go and take the piece and then do that. It's a very complex process that requires to understanding how the individual brain works and how where the seizures are coming from and what is the relationship between the area in the brain that is generating the seizures in relationship with areas that are important for function. We want to provide a curative therapy, but without affecting anything that makes the person who they are. And that includes, of course, motor function, our ability to move, our ability to talk, our ability to understand things, and so on and so forth. In pediatrics, again, we are dealing not only with this conundrum of delineating the seizure onset, but also with the young brain ability to reorganize and overcome deficits and things like that. And there's evidence now that the longer the seizures and the epilepsy goes on, the more comorbidities in the future in adulthood. So if we tackle this early, we can improve development, we can take advantage of plasticity, and we can really make a difference. We have different ways to do this. And the most common way that we do this is by what we call subdural electrodes. And that's actually our standard, semi-standard of care, not that much anymore, but it's a little bit more aggressive. It requires opening of the skull. It is obviously recording the seizures. We have to put some electrodes inside of the brain to try to delineate these areas. However, there are several complications such as infection, headache, pain, ICU admission, and so on. And this the approach tends to just be or limiting us to look at very specific area of the brain and only in one hemisphere of the brain. Lately, and since the last 5 years or so, the different centers of epilepsy across the world, including Europe and our neighbors in the South, had moved to a different approach. And that's the approach that Travis actually underwent to with the support of our colleagues from the adult epilepsy program. And it's robotic implantation of a stereo EEG. So what does this do? So basically what that helps us to do is to implant electrodes with the help of the robot that make us put these lines in different areas based on our prior investigations and so on to try to delineate the area of performance. What this allowed us is certainly a less aggressive surgery without the need to do a major craniectomy, reduces significantly complications such as infections and other complications related to the length of the process. And it's certainly a very good way that we can investigate different areas of the brain, and we can investigate both sides of the brain if it's necessary, and it can be done very safely with the help of the robot. It definitely decreases the surgical time. So from what we usually do with subdural electrodes, from 8 to 12 hours of insertion to 2 to 4 hours, it gives us very predefined and very almost perfect trajectories that are very safe to use. Is very well tolerated for longer recordings. Travis, as an example, he was walking and going to the cafeteria and hanging out with the electrodes there without causing any problems. Is minimal invasive, less risk of infection, and again, is now the standard of care in United States and Europe for pediatric epilepsy surgical centers. So what are we doing here in Ontario? And I want to really highlight the efforts that my colleague, Dr. Carter Snead, has done to spread the awareness of epilepsy across our province, and not only with the public and the citizens, but also with our policymakers. And back in 2008, Dr. Snead and other colleagues met with policymakers in Queen's Park in Toronto, and they put together a plan to improve and expand the care of epilepsy across Ontario. And it started with the designation of the academic hospitals in Ontario of the capabilities that they could offer to people living with epilepsy. So in a nutshell, I'm going to show you Children's Hospital is here with our adult counterpart. Red is pediatric, white is adult. And we were selected as a regional epilepsy surgical center of excellence. Only us and the Hospital for Sick Children are the only two hospitals in the province of Ontario that perform state-of-the-art epilepsy surgery. And definitely that carries a huge responsibility, and it carries and it gives me big proud to be able to provide this type of care to families along with the amazing team that we have put together. So in order to do that, as we mentioned, we have to put together the pieces of the epilepsy program. And the epilepsy program in London is, it compounds different things: inpatient services, outpatient services. However, it's, to me, more like a linear or hierarchical view. Is more like a loop, because the patients that we see in our outpatient services in our comprehensive epilepsy clinic, for instance, are the same patients that we are going to send to our pediatric monitoring unit and EEG unit, and our epilepsy surgical patients are going to also to be seen in our comprehensive epilepsy clinic, and so on. We require, again, a different number of expertise in different domains to help us to understand and to cover all the bases of this complex condition that is epilepsy. So I'm just going to touch base in little tiny bits of knowledge on what we do and what are these things. So the pediatric EMU, the epilepsy monitoring unit, is a place where we bring our children and we record the seizures while the EEG or the brainwave study that is put here is running. This is one of the most important diagnostic tools that we have in epilepsy that help us to make diagnoses, and definitely is one of the most important tools to evaluate for children that may be candidates for epilepsy surgery. And in a nutshell, typically what happens is our EEG technologies is going to be put all the electrodes in the child's scalp, then it's going to be wrapped up, and then it's going to be connected to the computer that is going to record the brain waves. The patients can be in the hospital with this procedure, either one day, either 1 week, depending on what we need. Our techs are really good at doing this, and this is very important. We increase our pediatric EMU admissions during our time since 2016 from, as you can see, 43 in the year 2016 to almost 200 in 2019. So while we have an up and running 2-bed EMU unit. And we have been dividing our admissions in 2 major groups: children that are admitted for 5 days that are typically our candidates for epilepsy surgery, and children who are admitted for just 1 day that are typically more for diagnostic procedures. And as you can see here, in 2016, there were only 9 children that were evaluated for epilepsy surgery, while in 2019, we evaluate pre-epilepsy surgery and 123 children admitted for our 5 days. Is this enough? No, we have still a year waiting list to admit our patients. So definitely, it's been a work in progress, and we have champions to have helped us to make this happen, including our amazing EEG technologists. We have improved our referral process, and we have developed by the different projects, especially led by our amazing nursing staff, to provide education and to provide resources to families to welcome them in the pediatric epilepsy monitoring unit. And this is highlighted very nicely in our website. We still, again, we have challenges. We have a waiting list of around 200 patients waiting to be admitted to our unit due to limited resources that we still have. And unfortunately, still among our colleagues in other centers, we are still the one with the lowest number of beds and the lowest number of EEG techs still. So a lot of work in progress that we need to do. My other great proud development in this regard, and again, it's a team effort, is the Comprehensive Epilepsy Clinic. And this Comprehensive Epilepsy Clinic is a multidisciplinary approach where we look after children and their families living with epilepsy. And we provide care across multiple domains. And we provide education to our families and resources to learn about epilepsy and to be very autonomous and self-efficient in taking care of their seizures. Counseling by our amazing social workers and nursing staff, transition to adulthood, our epilepsy transition coach, genetics, ketogenic diet, epilepsy surgery, and definitely our Comprehensive Epilepsy Clinic has put us in a position where we can provide the opportunity to conduct clinical research to understand better all these areas of epilepsy. Our Comprehensive Epilepsy Clinic was developed in 2017, and as you can see, that has been a significant growth in those 3 years. And around now, we typically have like around 500, 600 visits per year. The Comprehensive Epilepsy Clinic has also increased our surgical evaluation. So patients, we identified a patient like Travis that might be a surgical candidate in the Comprehensive Epilepsy Clinic, and we start the process to understand where their seizures are coming from. And as you can see, post the Comprehensive Epilepsy Clinic, our evaluation significantly grew, and our surgeries also grew as well. Not to mention the number of epilepsy surgeries that we have performed lately in the last few years. And even despite COVID, we were able in 2020 to perform almost 20 surgeries. Unfortunately, our patients who are candidates for stereo EEG, specifically for the robot procedure, had to put on hold because, of course, the burden to go and move to the adult side was increasingly concerning with the COVID-19 situation. And going back to that, this is our current process for our patients who require access to robot-assisted stereo EEG. So, and that was Travis' actually experience and his family, Tim and Melissa. So we do it via adult epilepsy services at the moment. So the child needs to be put the electrodes in the university hospital in the adult services, and the pediatric epilepsy surgical team needs to go there with the nurse, with the anesthesia team, and then the child, after the electrodes are placed in, is transferred back to children's via an ambulance. And I just put here a picture of Google Maps for you to get a sense of a child who has recently just coming off of anesthesia that has to do this journey from the north part of the city all the way to us. Again, the waiting list to achieve this procedure is incredibly long right now because the limited access due to competing adult patients, and right now with the COVID-19 pandemic, the mixing of pediatric and adult patients has not even been considered. I'm also very proud to mention a few of our not research, that would be Dr. Speechley talking about that, but more our innovation in the pediatric epilepsy program. And I want to highlight the shared decision-making program, and that was one of the amazing things that Dr. Craig Campbell and a group of very enthusiastic innovators brought to the hospital. It's led by Bonnie Wooten, who is our shared decision-making coach. She's a nurse by training, but she helps our families to understand and to look to the epilepsy surgical process from their own values and their own living experiences. So she meets independently with families and helps them, providing resources and providing different materials to navigate the whole process of epilepsy surgery. Epilepsy surgery requires families to make different decisions throughout the process. So her valuable work has been amazing, and it's quite unique because to my knowledge, there's not any other pediatric epilepsy program that has these services in Canada. And I am going to actually venture to say in North America. Several things, and again, I'm so proud of my team to have innovators that merge their own ideas and bring the 21st century to the front line. And that includes our fantastic website that was put together by Michelle Gratton, our future NP and an amazing nurse case manager leader right now, that compile all this amazing information. And that Dr. Carter Snead even mentioned that is one of the coolest pediatric epilepsy websites that he has ever encountered. And if you haven't seen it, I invite you to look at it, because it's very informative and it has all the information. Is being used across beyond the boundaries of our hospital. SickKids refers to our website, and other centers also refer to our website. We are also very active social media advocates, and we advocate for our families, and we share knowledge with other experts across the world and across Canada via social media. And definitely one major milestone that we did, and definitely with the support of our colleagues from Adult, is that in 2018, we were the first ones in Ontario to do this robot guided stereo EEG in this young man who is Travis, now seizure-free, playing competitive football and living a happy life. What is our vision for the next 5 years in the pediatric epilepsy program? Well, from the clinical perspective, I think we can have a lot of room for improvement and expansion and growth in the EMU settings, in the comprehensive epilepsy clinic settings, and certainly in the epilepsy surgical settings. So there's lots of areas that would be important for us to increase resources and increase capabilities. And again, this is not a one-person job, and this would have never been possible with the support and the talent of all of these folks that are in this picture. My friends from the hospital, the Children's Hospital, my provincial colleagues in Ontario that are passionate advocates for the care of children with epilepsy, my adult epilepsy colleagues in University Hospital, Epilepsies at Western Ontario, Children's Health Science Centers, and definitely Children's Health Foundation, who has been now joining the efforts to make epilepsy awareness and to bring epilepsy to the front line. And with this, I'm happy to answer any questions.
One of the questions I'll put forward to you, Dr. Andrade, and I do hear this quite often, would you say that epilepsy is much more prevalent these days compared to in the past?
That's a great question. I think it's probably the same. However, I think we have more expertise and more tools to really recognize it and identify that, as opposed to what we have 10, 20 years ago. And I think epilepsy and in general neurological conditions are bound to technologies that allow us to understand the brain in a way better fashion as what we have back 20, 30 years ago. So I think it's more about what the tools that we have than really the prevalence. And I also think there's way more awareness, so people were more comfortable diagnosis, asking questions and bringing their families when they are concerned about the possibility of epilepsy.
Great. I have another question here, and this is for the Heggie family, if you're standing by there. One of the things that folks are asking about is, how would you say COVID has affected your journey over the last 14 to 16 months?
Well, I suppose it's on a good note, it's allowed us to have virtual meetings. We live about an hour from the hospital, so there's been some times and some follow-up meetings where we've been able to do it remote via Zoom. That's as far as our health interaction. But I would say the rest of our life is probably, there's probably not been a whole lot more things impacted from COVID than anybody else. The same impact that everyone's having.
Great, thank you for that. The other question I have, and could I please just remind everyone to just feel free to ask any of your questions under our chat section. And again, we'll just keep addressing them as we move along here. But one of the other comments that I've got is, it must be very scary to remove any part of the brain. How do you overcome the fear of brain surgery in children and with the families?
Is that for me?
Yes, please.
Yeah. So, yeah, no, definitely, it's a very serious and very important thing, and I totally bring that statement specifically to my families. I always tell them, I know brain surgery sounds incredibly scary when we bring it as a possibility, but I think in the other hand, leaving a child or a youth with epilepsy, having seizures all the time, and having all these effects in their quality of life, definitely brings that fear away, in a sense that if we do things right, and if we have the tools and we understand the child's brain well, we have very well odds to actually cure that child from epilepsy without causing problems. And the process to get there is long, because I have to understand where the seizures are coming from, and I'm making sure that removing that area, I'm not going to cause any problems. So that takes a lot of studies, different pictures of the brain, different testing, different workup, for us to put all the pieces of the puzzle together to say, sure, you are a safe candidate for epilepsy surgery. This is what we are offering. And we always personalize care. So every child is different, and we do a personalized evaluation to each of them to make sure that the procedure is safe. And as it's really it's safe when it's done appropriately by the people who have the expertise to do it.
Great, thank you for that. And the questions are rolling in now. I have another. Dr. Andrade, how much would you say that genetics plays a factor in epilepsy?
Yeah, no, that's a fantastic question. I think in the last 10 years, I want to say, there has been a boom of genetics in epilepsy. And we have been understanding many of the things that we in the past were unknown, and epilepsies of unknown etiology. Now we can identify some target genes. And I think the future of epilepsy is going to lay on that field, because many researchers, especially in the basic areas, are developing genetic therapies that are aiming to change those abnormalities and turn some of the most severe epilepsies that sometimes we see that unfortunately are not candidates for epilepsy surgery into an epilepsy that is more controlled. So I think we are going to have a lot to say about genetic therapies in epilepsy in the future. Now it's more about diagnostics, but I think we are moving towards therapies in terms of molecular genetics and things like that.
Great. And speaking of the future, one of the other questions is, do you think that a cure is actually part of the future?
I think so. And I think we have already some cure. Again, right now as we speak, the only curative therapy for some epilepsies is epilepsy surgery. But I think in the future, we are going to be able to take away those mutations and then cure epilepsies from the molecular level. So I think this is what the future will bring.
That's terrific. Any other questions? We can certainly ask as we move along. So I think I will move along just to keep our program going. Thank you so much, Dr. Andrade. I'd like to now invite researcher and epidemiologist, Dr. Kathy Speechley, to the screen. Kathy is with our Department of Pediatrics and a scientist at both Children's Health Research Institute as well as Lawson Health Research Institute. Welcome, Kathy.
I'm going to share my screen here. Are you seeing my screen?
Not yet.
Not yet.
Oh, okay. Hold on a second here. Go.
Got it now.
Got it? Great. Thank you. Just get myself out of the way there. So thank you very much. It's an honor for me to participate with this panel of experts, including Travis and his parents who are experts in living with epilepsy, and Drs. Andrade and Campbell who are experts in providing clinical care for epilepsy. So my part in this is to share with you some of the research that our team has been doing that's designed in a way, I guess, to try and broaden the circle of care that we put around families living with epilepsy to surround the actual medical care to try and deal with the broader aspects of life living with epilepsy with a goal to try and maximize quality of life in children and their families. So you've heard quite a bit about epilepsy so far from our first two speakers, and we do know that children living with epilepsy and people in general with epilepsy tend to have poorer quality of life than do their population peers in the general population, and also they have worse quality of life than children living with other chronic conditions such as asthma or diabetes. And this is important to get this part, that the quality of life seems to be reduced for those who actually have good control over their epilepsy or have epilepsy freedom. So quality of life can still be an issue for some people. So what the premise was for beginning our program of research, initiating the work we do, is the colleagues of mine that you've heard already speak and their colleagues realizing that controlling the seizures is not enough. Of course, that is the primary goal in clinical management of epilepsy, but it's really insufficient in the sense that living with epilepsy means to live with a very complex set of issues that Dr. Andrade has spoken about. And it's not as simple as finding out that your quality of life is dictated by the type of epilepsy or the severity of epilepsy that you have. It seems to be much more complicated than that. So that's what we set about quite a few years ago now to try and solve some of these problems. And that's when we began the health-related quality of life in children with epilepsy study, or as we refer to it, Hercules. So what we wanted to do was take a much more careful look at the course of quality of life in children over 10 years. So before that, we had individual snapshots of what goes on in quality of life, but no one had really looked at it over time to look at how it changes over time. And importantly, to look at what are the risk and protective factors that really seem most important in determining quality of life. So that's the mission that we set out to work on. And in Hercules, what we did was we collected a group of children and their parents to follow them from the time of their diagnosis of epilepsy all the way to 10 years later. And we invited families across Canada to participate, and we had almost 400 families who agreed to participate with us in this research. We were trying to look at what happens to quality of life over time. What we found out is the quality of life on average for these children in our sample tended to be compromised at the time of diagnosis and then gradually increase over time. And what we pointed out that others hadn't found before is that we were able to identify distinct subgroups of children with different patterns of quality of life to give us a clue on what might be, how we might be able to change those trajectories of quality of life. We did find out from our study, and we were the first to do this, that quality of life tends to improve over time, and that after 2 years, improvements tend to be sustained over the next 8 years, which is how long we followed these children. Because we had the advantage of looking at youth 10 years after diagnosis, we were able to get self-report from these youth. And we found that in our group of youth, just under 40% of them reported that they had depressive symptoms that we would consider to be clinically significant. We also found that youth with epilepsy worry about their epilepsy, and just under 40% had experienced epilepsy worry within the past 4 weeks at the 10-year follow-up. And importantly, among those who expressed that they had epilepsy worry, over a third of that group had been seizure-free for 5 years. So controlling the seizures was not really enough in that case to prevent them from worrying. We also looked at the well-being of the parents of these children in our sample, and we found that depressive symptoms was common among these mothers, with about a third of them being at risk of depression. And we were also to be able to do some fancy analysis with this, where we were able to look at different patterns of maternal depression over time. So putting together all of the findings that we had in this 10-year study, we were able to come up with a much better explanation about what drives health-related quality of life and well-being for these children and their families. And not surprisingly, we found out that having less severe epilepsy at diagnosis was important, as was not having additional problems such as cognitive problems, behavior problems, and motor problems. But unique in what we found, which was quite novel, is that we found that better parental well-being and family environment early on were also very important in determining health-related quality of life. And in fact, we found that at times it was more important than the epilepsy-specific factors themselves. So focusing on this gave us some really important clues about where we might wish to intervene, because that's ultimately our goal, is what care can we provide additionally to help families to improve quality of life. So we thought that really focusing on parental well-being and family environment, as well as the children, was also important to consider. And that's what led us to the work that we're doing right now, which we are very excited about, which is combining my program of research with that of Dr. Karen Bax, who Dr. Campbell mentioned is a psychologist. And we've developed this new program that we're testing in families with epilepsy. Dr. Bax developed this program called Making Mindfulness Matter. And now in this study, we're applying it to families with epilepsy. So when we were developing this intervention, we tried to think, where should we look? What should we do to come up with a new program to try? So we put all the facts together from our work and the work of other researchers. So we know that a very large percentage of children with epilepsy may have cognitive or mental health problems in addition to their epilepsy, and that perhaps half of their parents suffer from anxiety or major depression. Our work demonstrated that the family environment at times has a greater influence on children's quality of life and mental health than epilepsy related factors. There's widespread agreement that there are definitely unmet needs regarding the emotional and behavioral problems in children with epilepsy. And you've heard Dr. Andrade talk about how complex the medical care of epilepsy can be. And then you add on top of that the dealing with emotional and behavioral problems of families and of children with epilepsy. So there's definitely a pressing need for low cost and scalable interventions to improve quality of life, as well as of children with epilepsy, as well as of their parents. And these really need to be scalable. So we need to look at interventions that are feasible to deliver, not just at Children's Hospital, but in communities where these children live across our region and beyond, across Canada, across the world. So we reasoned that a program would probably be best accomplished if it could be delivered in group settings by community organizations, so taking it outside of the very busy and complex clinical setting. So what we're working on is testing a program, Making Mindfulness Matter, that was developed by Dr. Karen Bax and her team, which is an 8-week concurrent program for parents and children. It offers a new approach to parenting in stressful situations, and it helps children build skills that manage emotions and behaviors and build caring relationships with those around them. It's delivered via a video conference by non-clinician staff to groups of 4 to 8 people. So how this works is that the M3 program explores how our brains work under stress, and it teaches 2 key things. The first is mindful awareness. This means paying attention to the present moment, to our thoughts, feelings, bodies, and to others, as well as to our surrounding environment, and positive ways that we might respond using social emotional learning. And I'll talk about that in a minute. So mindful awareness, if you want to think about it this way, actually provides a gap between our thoughts and our feelings and the response that we have to those. And the second thing, as I mentioned, is social emotional learning. And this refers to abilities such as self-awareness, why we do the things we do, self-regulation, how we can manage our behavior, social awareness, to be able to empathize with others and understand their needs, and identify how our actions make others feel, and develop positive relationship skills. So these abilities really help us make better decisions about how we respond. So thanks to the COVID-19 pandemic, we've had to modify our program. We started out our intervention by offering this group program in person in settings out in the community. And then when the pandemic was declared, we had to pause, and Dr. Bax and her brilliant team modified the program to now be delivered live interactively online. And we tested this with 3 families to make sure that all of the components were intact and that was working well, did lots of tweaking. And then we began offering our intervention again, full speed. And recruitment's ongoing with a plan that's been delayed now, but we hope to finish by the fall of 2022. So far we think this has been going quite well. We've learned an awful lot thanks to the facilitators, who are epilepsy educators that we've trained from the Epilepsy Southwestern Ontario team. We've learned a lot from them and their feedback about how it's going, and also especially feedback from families about their experiences. We know that families have been through a whole lot with the pandemic, having to do online learning, schooling at home, and now we're adding this into the mix. But you can see some of the comments here that families have provided us. So we're getting lots of positive feedback, and we really look forward to the opportunity in a year and a bit to be able to analyze our results, to be able to determine whether we believe this is feasible, our program to offer to families across the region, and to take a preliminary look at the extent to which we're able to improve quality of life of these children and their parents and their overall well-being. So I am very grateful for the amazing teams of people that I've worked with on these two projects that I've described tonight. None of this would be possible without their combined expertise, because that's the theme that you're hearing tonight, is that we need to put lots of kinds of expertise together to be able to come up with the very best management for epilepsy for children and their families. And I just need to say that what was really key to this program of research that's unfolded over years is the support that we received from the Children's Health Research Institute, from the Children's Health Foundation, to offer initial funding and bridge funding that allowed us to be productive enough to compete for national grants that we've received that have provided the major funding for this project. So we are extremely grateful for that. And of course, in all of our work, what we do is we go straight to the experts. And the experts in this case are the children and their parents living with epilepsy, to get their perceptions and help us understand what are the most important outcomes for them in their lives that will help us provide care that helps to surround the expert medical care that you heard about earlier tonight. And I'll stop there, and I'm happy to answer any questions.
Kathy, you mentioned quality of life. Can you talk a little bit about what you mean by this term? Is quality of life something that we can measure, or how would you measure that?
Yes, thanks for that question. So quality of life is a multidimensional term, and it is definitely something that we can measure. So we've actually participated in that in our group in refining the measurement for this. So it combines many aspects, and the important thing about this is that health-related quality of life is the perception of the children and their parents. And in our study, the children started out, they were quite young, so we had the parents report on the children's quality of life. So it looks at several aspects of life, including social, psychological, physical functioning. So it's putting everything together to describe the way in which your health affects your daily life. And we've come up with some very sophisticated measurement over the years, which has found to be very accurate in giving perceptions from the experts, the children and their parents, about how their life is impacted.
Great, thanks so much for that. And I wondered if maybe we could pop back to the Heggie family for a question. I wonder what Travis or his parents would like us to know in the general public if we were to come across someone who was having a seizure, or we understood they had epilepsy and they needed some help. What would be some tips that you could offer?
I would say you coming across people who need the help. There's great resources in the community, and so definitely refer them to Children's Hospital in London. In this circumstance, Epilepsy Ontario is good. There's amazing resources, and you know, as you see, there's if 1 in 100 are epileptic. There's a lot more people out there, and it's amazing as you get speaking. There's a lot of resources out there, and what you learn from other people. And so, you know what? Don't hide it, and ask questions, and be proud of what people are trying to do to find the resources so they can get the help for the people that they have needing help. So I recommend that, to reach out to the resources that they have in their communities.
Great advice. Thanks, Tim. And I've got another one here. What can families do to be that supportive agent for a child to enhance his or her quality of life?
And is that to me as well?
Yeah, I actually wouldn't mind you taking a stab at it, and then maybe Kathy.
I would say, supporting the child who has epilepsy and creating as much normalcy as they can. And every family is different, and everyone's approach and reaction to it is different. For us with Travis, we really wanted to keep things as smooth and as normal as possible. And by no means trying to hide his epilepsy when he was having seizures, but really trying to move forward and not create too much out of it. And so that he did having a semblance of normalcy and immediately springing back to doing his normal activities. And so that's what we felt as though was appropriate as the family for supporting Travis as he was going through this, and then really getting him the resources and being there to advocate on his behalf with the healthcare professionals.
Oh, terrific. Thank you, Tim. Kathy, do you have anything to add?
That was a great response. Yes, I think that, I'd add to that I think part of this is, first of all, recognizing the complex package that comes with a diagnosis of epilepsy, and working to recognize that epilepsy has an impact on many facets of the child's life, as well as an impact on the family, an extended family. And I think that initial recognition is the first step in being able to access the resources to help with that. So recognizing that it, for example, can take a toll on the mental health of the parents. And so so recognizing and supporting, acknowledging that in mothers, for instance, that there is a high prevalence of depression, and trying to deal with that, because we know that the well-being of parents is very closely related to the well-being of the children. So it's this kind of reciprocal relationship. And so I think the first big step is recognizing this, calling it for what it is, and then accessing the resources that are available. And that's why we hope that our research will help make more resources readily available. And lots of good resources are available online, but the first step is being able to actually acknowledge that there is an issue, and you're very typical in having this, that lots of families are dealing with similar things.
Great answer. Thank you, Kathy. Do we have some other questions? We've got some time here. Here's one. Are there ages when epilepsy is more of a challenge with children and their families?
I can answer that.
Great, thank you.
I think we deal especially with issues in very young kids when the seizures start changing from the very early on time in life, from infancy to when they become a little bit older, and the seizures, as the brain develops, the seizures also develop. So we sometimes see how a very subtle seizure in a baby can become more form in an older child. That brings a lot of stress in families sometimes. And it's our duty to teach them and to let them know how the brain on its own is changing. I think the other very sensitive time that we deal with, besides that one, is adolescence. And there are several reasons for that. Adolescents, on their own, they have struggles finding their own selves, identity, and so on. Plus that having to carry with a chronic condition such as epilepsy, which is unpredictable, that can cause seizures at any time. They are trying to become autonomous, to get their independence, and epilepsy can interfere with those things if it's not well controlled. And I've seen greater rates of mental health struggles in that specific population in adolescents, and definitely those are associated with the inability to do the same things that their peers are doing, such as getting driver's license, hang out with their friends, going to a party, things like that, with that fear of having a seizure at any moment, achieving their goals in school, things like that. So I think those times are very critical, in my opinion, in children with epilepsy.
Very helpful. Thank you, Dr. Andrade. Just looking, I think we have another one coming in here. Just a comment that, and really important for our guests to know tonight, that Children's Hospital has prioritized for Children's Health Foundation to fundraise, of course, for the robotic arm equipment, and that we are actively fundraising for what we call ROSA, to improve the lives of these children. So really important to cap off here near the end. Very important education, awareness, and all of these important things tonight to make the public aware of why this is such much needed equipment. Any comment, Dr. Andrade, to build on that?
No, I appreciate, and we are incredibly grateful on behalf of the epilepsy team, on behalf of my patients, and Craig knows how grateful we are of the support from the Children's Health Foundation on this incredible effort. And we couldn't be more excited about the fact that we're going to be able to offer this technology to more families that have been waiting patiently to try to access this specific technology. We are highly appreciated, and certainly the efforts and all the people that would pitch in to make this happen. Certainly we are incredibly grateful for on behalf of all the patients and families in Southwestern Ontario.
Great, thank you. And I have another really great question here. In your research, you said that family can be a major factor. Beyond being aware of and sensitive to the pressures the family and children are under, what was it that you identified in your research that was most helpful?
Well, I think a really important take-home message from our ability to follow these families over 10 years is that the majority of children and their families do very well. So before this, it was really hard at the time of diagnosis when it's a very stressful time and families are trying to envision what changes are going to happen in their children's lives, what life is going to look like. It's very helpful to be able to see that most children will gain control over their seizures, and also the information that we collected about what are the factors that seem to improve quality of life. So this way we can tailor our advice and the resources to try and target those families who might need it most, and give suggestions, evidence-based suggestions of what has been demonstrated, what we know from the families we've studied has been useful in improving quality of life. So I think that it's we've heard a theme here, it's very scary and frightening, but I think that the majority of these families, when we look at their outcomes, are doing very well.
Great answer. Do we have any others? And any other closing, sort of food for thought from our panelists that you'd like to add for the audience who were just so great to come and join us this evening?
Vicky, well, I'd certainly just like to take this opportunity to thank people who joined us tonight. It's really important for us to share our work. I think you can hear in the voice of Kathy and of Andrea, that this is not just a job. This is a calling. This is a passion, and to hear it reflected as well with Tim and Melissa, Travis, that journey that they had, which was about connection, about feeling supported. That's the environment that we want to create for every child who has to hear and deal with this term of seizures and epilepsy. We want to wrap care around them at Children's Hospital, so that whatever their journey is, we're there to kind of find what they need to reach that that other side successfully, and feeling like they can look back on this as something where their needs were met. And that's what we're really all about. And I want to just go back to the Rosa robot as well for a minute. I mean, you've seen in Dr. Andrade's presentation tonight, how technical and these surgeries are, the brain mapping that we saw, and having these state-of-the-art equipment is really critical. So I just want to thank the donors for for their participation in making Children's Hospital here in London a leading center, really a leading center for epilepsy care at all levels. So thank you to my colleagues, Kathy and Andrea, for showing their passion tonight, and thank you to everyone at CHF and the donors for hearing us.
Thank you, Craig. And as we always like to say at the foundation, it really is all about the kids. So very well captured, Craig and team. I'd like to at this time, just mindful of we're at 8:25, I would like to extend a heartfelt thank you to Tim, Melissa, and Travis Heggie for joining us this evening and sharing their very personal journey. I'd also like to thank, of course, our esteemed specialist panelists. We couldn't have done it without you and your expertise. We hope that this presentation has been really insightful for all of you. And I'd like to just let you know that our next education event we have planned for late September, and it's going to focus on our NICU, so the Neonatal Intensive Care Unit. Date to be determined, but you will certainly be hearing from us as far as an opportunity to join us. So again, thank you to everyone. We hope you go off and have a lovely evening. We'll see you again soon. Good night.